A mysterious virus caused a pandemic, limited where travelers could go, and had people stocking up on hand sanitizer. Now, we're not talking about COVID-19. More than a decade ago, we were fighting H1n1. The World Health Organization said it was the first pandemic since 1968, and then President Barack Obama declared it a national emergency. On tonight's Eye on Keloland, Brady Mallory digs through our archives to show you how the world responded and what is similar and different compared to today's fight against COVID-19.
It started out slowly.
It may not have hit home yet, but the South Dakota Department of Health is taking action.
We're asking that when patients come in with influenza-like illness, with flu symptoms, that those tests, that physicians are testing those patients.
And it took a while before people took H1n1 seriously.
I definitely think it's being overhyped.
I think if you use common sense, wash your hands, make sure you're using sanitation if you're at work or whatever, I think you'll be okay.
But it didn't take long for H1n1 to escalate. In 2009, the H1n1 flu pandemic spread globally. Just in that first year, the CDC estimates there were more than 60 million cases. And the virus killed up to 575,400 people. Initially, people called it swine flu.
Swine flu symptoms are very similar to the human flu: coughing, sneezing, fever, and chills. And like seasonal flu, this strain can cause underlying chronic medical conditions to get worse.
This virus is expected to spread to other areas and cause additional people to become sick.
At this time, global leaders were limiting travel. We were sanitizing counters, and people were wearing masks.
In South Dakota, the masks are few and far between.
We don't have any.
Tough to come by.
Tough to come by.
Does this all seem familiar? Well, it is, but it isn't. Kelly Hansen from Twin Cities Live, who worked at Keloland News when she was Kelly Grant, covered H1n1 extensively and remembers seeing state leaders respond.
I remember them kind of comparing it to what they had to do for 9/11, just the fast acting, fast thinking, what happens if we're hit hard.
Hansen also remembers the initial H1n1 process concluding rather quickly.
When H1n1 was unfolding, did it feel like the future was as unknown as it feels like it is now?
You know, what was interesting about H1n1 was I went to Iowa where they were making the vaccine. And so that gave people hope.
Dr. Wendell Hoffman says, though H1n1 and COVID-19 are similar, they're both respiratory illnesses that spread from person to person. They both threaten vulnerable populations, and we don't have innate immunity to either. The two viruses are different. COVID-19 is more contagious and more mysterious right now. He also says the H1n1 vaccine was key to recovery.
Did that give people a lot more certainty and maybe an idea of when that pandemic would end?
The essence of a vaccine is that you can protect yourself, and as you develop immunity, what we're doing now is that the community is acting as the immune system. Through our social distancing, we are functioning as a big immune system.
H1n1 now seems like a distant memory as a new fight against COVID-19 continues. With Eye on Keloland, I'm Brady Mallory.